Hey everyone, it's Lisa here with Hope for STD, and today is our first official clinical trial day in our 30-day quest in honor of World Sickle Cell Day, which is only 18 days away on June 19th. So stay tuned for that when the whole sickle cell world will have an explosion of awareness and education for you. We'll be part of that. Today we're actually just going to start with a really simple trial that I found on clinicaltrials.gov. Remember, all of my information is from there, and the link to this trial directly will be posted below in the comments. So if you want to go directly to this trial and find out more information about how you can participate, just click on that after the video. So this one is actually just a basic screening put on by the National Heart, Lung, and Blood Institute, which is part of the NIH, the National Institute for Health. They're based out of Maryland, and so what they do for this trial is they just screen people in that have blood disorders, not just sickle cell, but sickle cell does count, any form of sickle cell disease, and they screen you in, and then the results from this database go into all of the thousands of research trials that they have out there that you might match up. So it's a really nice, simple way to get your foot in the door with the NIH to see if you match any of their trials. As you will find out, I'm going to list the sponsors for every single trial I explain, and many, many of them are sponsored through the NIH. So if you live near Maryland, then this would be a really great way to get your foot in the door to get screened for all the potential trials out there. And if you don't live in Maryland, I'm still kind of unclear based on the information for clinicaltrials.gov. So at the end, I will give you the contact information. You can find out if you can actually just speak with your hematologist in your hometown, and if they can then send the information on to the NIH, because a lot of the trials sponsored by NIH are actually done around the country, not just in Maryland. So, okay, so let's just go over what exactly they're asking you to do. So age for this is any age. They didn't have any age stipulations. They also didn't have whether it was female or male, so both genders can participate. They didn't have any specific race stipulation, so anybody of any nationality, however you identify, is able to participate. They also didn't specify if it was certain types of sickle cell disease. Some studies will say just SS or SS and SC or things like that. This was any type of blood disorder, including any variation of sickle cell disease. So that leaves the door wide open for every single person in the sickle cell population to participate. They didn't even have exclusions for pregnant women who were living with sickle cell, which that was an exclusion on almost every other one that I had. So that was kind of exciting that everybody could participate. It was a really wide open trial. What they're going to ask you to do, they're going to ask for a complete medical history. They're going to do a physical examination, similar to like when you go to your primary doctor. They'll do some basic blood tests, which in the world of sickle cell is every single time you walk into the doctor, so no surprise there. They also do a cheek swab to see if you have any bone marrow matches, and they might possibly do a bone marrow aspiration depending on, which is where they take a little bit of your bone marrow out to see if you match other people. They were kind of unclear about that. My assumption is that that was only for the healthy volunteers and not for the people living with any of the blood disorders, but I wasn't 100% sure, so you would want to talk to the trial coordinator about that. And then they're also going to gather a little bit more information about what medications you're taking and what your fetal hemoglobin levels are, and do a full panel on you if you're the person living with sickle cell. I will also say that they do take healthy volunteers as well. So if you're a person that is a family member of a person living with sickle cell, you can also get into the system, because a lot of what the NIH studies do is that they match a healthy person with a person living with sickle cell, and they try to match them based on age and race and demographics and all kinds of different things, so that it's almost like the same person. The only difference that this person has is that they're living with sickle cell disease, and this person is what they would call a healthy volunteer. So so for this instance, they're looking for both healthy volunteers and people living with sickle cell. So so that's all they're doing. That's all they're gathering. They're just basically gathering all of your background health information, getting some blood and some mucus from the side of your cheek, and then they pop it into the database, and based on that, they recommend you for other trials. So it's a really nice way so that you're not hunting through clinicaltrials.gov. You're now in the NIH database and can find out all the information and be notified for the trials that they sponsor that you would be a good match for. Let me just give you the contact information. It's Dr. Matthew Hsieh. I'm so sorry, probably butchered your last name. Heiehsieh. And his phone number is 301, everything's down below me, 402-7687, and I also listed his email below. And it would be really great to talk with your hematologist if you're not near Maryland, to find out if you can get put into this database through this trial, and then be, on the horizons for them notifying you when you are a match for other trials. A lot of people work with the NIH to get into trials where the cost is then covered. So that's one of the really nice benefits. Say if you're an adult trying to get a bone marrow transplant, or you're looking for a bone marrow transplant that's maybe a match from a parent down to a child, things like that, things that are still studied and not officially on the approved list. Working with the NIH, they do some of those more expensive trials, and if you're part of the trial, then all of those costs are covered. So getting into the database is a really great way to then have your name and all of your information and what you would be matched up with there and ready for them, and then they just call you once you have a match with one of the trials that they're doing, and you can decide to participate or get more information, and there you have it. Okay, so trial number 1 is done. It's screening for the NIH trials that they have. Simple, short, and sweet to the point. I put the link down below for the specific information of where I got this off clinicaltrials.gov. Post any comments or questions below, and I'll see you tomorrow. Bye.